All right. I want to talk about peptides.
I love talk about
I
peptides.
thought you might. I was like, we both
So
don't feel great.
disclaimer. No education purposes only. Nothing's prescriptive. Don't sue us. Blah blah blah.
Yeah, we're going to give you the exact 14-week cycle unit. No, we're definitely not going to do that.
I'll give you my peptide protocol.
Where are you sitting? Hard first question. Let's
Yeah.
drop the fucking hammer. Now, I need you to take what I need from you for the next 31 minutes.
This is how Ben talks to me before we do anything serious and important, guys. The Jason, say behave. So that's what I need out of you.
Is I need you to take your bodybuilding coach hat off.
Okay.
Go back to 2018.
Yep.
We're at Good Life.
Mm-hmm.
Sold out PTs.
Yeah.
Working predominantly with Gen Pop. Some clients that are really in the niche that we like.
Yeah.
But the majority of people we're working with want a transformation.
Cool.
Lose body weight, change their life,
Yeah.
get in shape.
Cool.
Is taking fat loss aiding peptides problematic?
No.
Yes or no?
Absolutely not.
Why?
Because there's other elements that we give people that they can't get from like said compound, and like there's other like things back then that would help contribute to it. They just weren't as effective.
Mm-hmm.
So yeah, like they're still going to need to have a diet to maintain the muscle mass that is going to be a big thing that will drop off when those medications are being administered. You know, bone density and movement and day-to-day vitality is still going to need to be worked on as well. Like it's not just like you isolate the weight loss, like sure. But I think they're just going to come to you for other things at the same time.
So what I was thinking about is like, I was out to change the world as a younger man. It was my goal. And we had things like waist trainers and fucking basically what was glorified glad wrap. That's like a fat loss agent that you wrap your stomach in.
Squashes your organs.
Yeah, like there's the waist trainer that changed your shape, but remember the weight loss wraps? Was literally just glad wrap that you sweated out and you looked leaner in the after photo because
of course
lost local
just squished everything
water.
together and just dehydrated yourself for a bit.
Fucking wild.
Yeah.
So those types of things were what that fringe population, 1 foot in the gym, but really just wants to lose weight.
Yeah.
It were doing that personal trainers were upset with at the time. And I think there's been something always.
Yeah.
It's the fucking carnivore diet. It's this.
It's just easier to. The thing now is like there was weight loss drugs go back 12 months ago.
Yeah.
There were weight loss drugs before that.
Yeah.
People just couldn't get access to them. Only certain people could.
Yeah.
So now there's just like a greater access to them.
Yeah.
For now.
Yeah.
But then people aren't
you
going
can go to your doctor and get them.
Yeah, and people can't take them forever as well.
Yeah.
So the thing, it's just like, I don't see it as being a big problem. Like I actually think it meaningfully contributes to the community quite effectively, because I know of people who have really struggled to, drop the weight and put themselves into a healthy position for certain things that they want to do, and these medications have allowed them to do that. So I'm like, well,
yeah,
it's really positive.
I've been back and forwards on it, and I actually had a conversation about TRT, where it was like chicken and egg. Like, does someone who's clearly low T, but isn't meeting the lifestyle factors that would create a high T environment?
Yeah,
you're overweight, you drink, you don't sleep enough.
Yeah.
You don't train. Blah blah blah.
So do you need the testosterone,
how do you start doing that when you feel like dog shit?
Yeah, that's it. So what comes first? The thing or the behavior?
Where's the grit to be like, nah, fuck it, I'm going to get it today?
Yeah.
When you don't have that because you're a pussycat, because you have low T, but then taking the T is cheating. But then if it changes all the lifestyle habits, and this is the same to me, it's like, yes, you need to also have all of the habits. And we're arguing like, well, 12-week challenge isn't wrong. 12-week challenge with no week 16 is the problem.
Yeah.
So taking the fat loss drug isn't wrong if you're also prioritizing training, resistant training, prioritizing dietary changes, lifestyle changes, all of that rather than just like, well, I take this shot and I still don't eat and I go out every weekend. I'm just smaller.
Yeah, I can't really relate because I work with people who take stuff and to get better. So I'm like, it'd be really naive of me to be like, you can't do any of that, because I work with like the most elite of clients. Yeah. And then they also use supplements to enhance that. So I'm like, well, like I'm already working with a subfraction of the population that are leaning on all of these things, and I still have a job. Like I still have a position here. So I'm like, why?
I'm just really curious if you have there's a criteria you need to hit, because this is what I'm getting the vibe from personal trainers online, is they have this arbitrary, well, some of them are just like, you can't take it at all because it's fake and cheating and whatever. Like, okay, I disagree with that statement completely.
Yeah.
Then it's like, well, the next step then is to say there's a arbitrary commitment level or behavior standard from the client. There's an arbitrary behavior standard from the client that they need to reach to be allowed to take an assistant that will help their progress and allow them to get the outcome with less friction.
Yeah.
And then, like, cool, you've got all your, like, oh, it's unresearched, it's this, it's this, it's this.
Yeah,
the percentage of personal trainers that are saying that online that have fucking done Melbourne Coke.
Yeah, just like...
Are you fucking kidding me?
Yeah, just railed off the fucking toilet.
Yeah,
in
like, bro,
public fucking nightclub and shit. It's like,
fuck me.
It's bad for you,
or
man.
they use that in the fucking... They use that in the trenches, so it must be fine. Like, fuck me. It's been around Coke's been around forever. It must be safe. Fucking hell.
Yeah, it's...
Anyway.
It's pot calling the kettle black a little bit there.
Yeah.
So where are we starting with? Like, people who say...
So there's a few groups. So group one, don't fucking take it at all because it's Chinese research chemicals and you have no idea what it's going to do to you long term.
I can understand that type of person. That's fine.
Yeah.
If you're in that boat, no problem.
I also would probably argue that there is a very high percentage of them that takes recreational drugs.
Oh yeah, of course.
That do that.
Oh, well,
so
you
just watch the contradiction of yourself within.
I was going to say, if you're clean, I get it.
Yeah.
You know. Yeah. But then I'm like, how many boosters you had, cuz?
My thing was even just like, cool, so you want to work a lot, you want to train really hard, and you want to be a higher operator. So how many of those people...
Yeah, addicted to like Zins and shit.
I was just going to say Monster, bro.
Yeah.
Just because you can buy it over the counter doesn't make it good for you.
Yeah.
So you're like, well, I'm going to use this aid to get the outcome that I want, but I've decided that aid's not okay.
Yeah.
It gets a bit... There's a lot of contradictory of stuff in
I agree. I think you should still, as a practitioner, be able to put your line in the sand and say, I'm not going to operate like this.
I think, so that's a different discussion as prescription.
Yeah, because these people can work with like a doctor, but I wouldn't be like hammering this person saying they're a fucking cheater and shit.
Correct.
Like you're a scumbag if you do that. Like, just do your job, which is like getting these people moving in the gym.
Do all the other stuff.
Yeah, like don't be beating them down. Like you're supposed to be lifting them up. Like
that's my position. Is I don't think the flag in the flag in the ground that you don't encourage it, lean on it, whatever. Yeah, that's fine. But don't shit on people that do.
Yeah, agreed.
And I don't think there is a very, very small percentage of the population of coaches that should even be discussing it with their clients because they have no idea what they're talking about.
Oh yeah, absolutely.
So that is probably a line in the sand that I would draw. If you don't know what you're talking about, don't start giving it to your clients.
Yeah, it's a fucking slippery slope anyway, man.
Yeah. So then there's the next group that there's a behavioral standard that you need to have for me to give you my permission and acceptance that you can do it. Do you hold that view at all? Is there...
Yeah, absolutely.
Is there like... Steph's come home from work, she's got a friend who's like overweight that doesn't eat well and all that kind of stuff, and she's like, she wants to take Retta. Are you like, well, tell her to go to the fucking gym first? Or are you like,
wouldn't even take that on?
Yeah.
Yeah,
in your head.
Look, if it
what's your perception of that?
I would say let's do a month to 6 weeks of getting everything in check. So that when we bring in something like that, we're going to be able to use the least amount to get the maximum effect. And that I do that with everything.
Yeah.
So it doesn't matter what said thing we're trying to deploy.
Yeah.
You got to look at the risk. The risk is using it, and then the risk is using a lot of it for a long period of time, and that's with anything. So the least amount you can have for the shortest window to get the maximum benefit is going to be the best thing to do. Yeah. And the best way to do that is still learn how, like, do all your lower hanging fruit stuff, right?
Yeah.
Yeah. So training's unlock, nutrition's unlock, recovery, sleep, hydration, like those things. Like if you have those, so
you need to do the STC habit formation phase, and then
absolutely
we're good to go.
Yeah, because then that's when you make this rapid change that people have always envisioned in their mind, and then you also come out the other side with like probably little to no, especially if some of the if you're losing something like Retta, like it's progressively looking like it's quite safe and effective, but we're just not quite there yet because they need to do the controlled trials for long enough for the FDA to approve it.
So,
but even just to go just on that, like the research side of things, they're actually like taking them off the research banned list every day. Like those peptides, like TB500, CJC, all of that. Like if you actually pay attention, they're taking them off that list. Which is
being proved safe.
Absolutely, because we're getting more body of work to be like, oh, this is the use case to make them effective.
Yeah.
So I would just say, be careful if you're somebody who is like flagging the hill, and just say it's like make sure you keep yourself up to date on what's going on. Just so you don't get caught out.
So then the argument is, you've been overweight. It's hard to put your shoes on. It's hard to go for a walk. It's hard to say no to the ice cream.
Yeah.
You don't necessarily, maybe you have, maybe you haven't experienced the emotional side of being overweight, the embarrassment, the self-blame, the self-hatred and all of that.
I have people close to me who have deep psychological layers that are deep-seated from their childhood that come out in their eating habits that haven't gone down this route, but I would actually, if they ever came to me and discussed it with me, I would promote it. That, and obviously seeing a therapist.
Yeah, so that was my question, is like if the chicken and the egg question, if they can lose 5 kilos, are they more motivated to buy Coke no sugar? Are they more motivated to go for a walk? Like, where are we there in saying, like, seeing the scale move down gives you the positive step forwards to be like, this is a good thing? Yeah,
there's just so many things involved in, like, the decisions that people make that are influenced by so many things. So just to be that person to just throw a blanket and be like, you're all cheaters, you're all a pack of this, you're that. I'm like, you really don't understand obesity. You really don't understand people, like, and you don't really understand medicine. Like, medicine's there to, it's like, okay, so these things are wrong, but like if you got sick, you go to the doctors and then they tell you to take whatever and you're like, cool, give me it.
Yeah.
Like, you don't research it. You don't look up and see if it's good for you.
Yeah.
You don't look up and see what the side effects are. You just go, oh, the doctor told me to take it, so I take it. It's like, that's also a little bit negligent on your behalf as well if you're going to go and say the same thing here. So, it's just an interesting...
Yeah, I think that zone is the most... I still don't think I have a solid position to say...
I can't...
Like, that someone in my family who's 30 kilos overweight that needs help to get started, I'm not completely locked in to say they should or shouldn't, whether they need it to get going or they don't.
I think they have to do it simultaneously. There has to be like
a whole overall.
No one.
Yeah.
As someone who has worked with people using things for a long period of time now, no one takes everything forever. Yeah. And if you do, you're fucking stupid. Yeah. Because that has really, really big ramifications on your long-term health. So everything is on and off. Right? So if you don't have really good fundamental layers below whatever you're adding on top to enhance everything, you are going to be left unstuck.
Yeah.
And so I think you might go to this next, like the people that are worried like these medications are going to cut into their work and stuff. Yeah. If you're like a general fat loss coach and you're worried, it's like you shouldn't be, because they're just like, I know people who just stop taking them and then just put the weight back on.
Yeah. Yeah.
Because it's like, there's a monetary investment that comes with it that's not cheap. It's just, it's taking the work away.
Yeah, it's kind of like, hey, your insecurity is showing.
Yeah,
like,
man.
a little bit. So
yeah,
I want to go into that with a story.